This was a very important session that I chaired in that mature data were presented about treatments which have, at least in the past, been conventional for follicular lymphoma and also about long-term maintenance treatment with Rituximab, which has been introduced relatively recently. There were two important presentations about stage 1 and a bit of stage 2 follicular lymphoma and the potential role of irradiation and of combined modality treatment. This challenge represents about 15% of the patients with follicular lymphoma and is widely regarded as an area in which trials cannot be conducted without at least international collaboration, and for which there may have been not enough enthusiasm for conducting trials anyway. Background data about the outcome of stage 1 and 2 disease in the era of PET scanning was presented in a descriptive international study which provides a very good background for deciding whether the control treatment for follicular lymphoma stage 1 should be irradiation or possibly watch and wait. Certainly the consensus of the people in the room was that irradiation was the treatment of first choice. The second paper about early stage follicular lymphoma was the report of a trial in which patients were randomly allocated after irradiation to receive systemic therapy, initially in the form of CVP and subsequently with R-CVP as it became widely used. The trial revealed an advantage in terms of progression-free survival. Unfortunately, of course, as with many things, this didn't lead to an advantage necessarily in overall survival. So it didn't really answer the question as to whether adjuvant chemotherapy or chemoimmunotherapy should be given. More importantly, however, it emphasized the fact that it is possible to run a trial in the area and that other trials should be feasible.